This year, Oxford has developed a vaccine against a virus that we didn't know existed at the start of the year. We've manufactured it, we've tested it, we've shown that it's effective in only 11 months. That's a massive achievement. My lab's been working on vaccines against what we call outbreak pathogens for a while, and those are the pathogens that we already know about, the viruses that are there but we don't have vaccines for them. But we've also been thinking about how to make a vaccine when there's a new virus that we've never seen before and how to be able to go really quickly. So when we saw the first reports of SARS-like pneumonia cases in Wuhan in China right at the turn of the year, we knew that this was something that we could respond to. Gradually the story unfolded that it was a new virus and it was a coronavirus, and then we knew that we would be able to make a vaccine against that because we've already started doing that with the MERS coronavirus. In order to make a vaccine, and particularly to do it quickly the way we have done this year, we need a team of people with lots of different skills. We need people who are immunologists, we need people who are medically qualified, we need nurses and statisticians, and we need people who can do the engineering and work out how to manufacture the vaccine and how to do the quality control and test it.
My research degree is in clinical medicine. Basically, I'm trying to work with tuberculosis vaccines, trying to understand the human responses that they induce. I'm a medical doctor as background, and I also have a Master of Science in Chemical and Biological Sciences.
I'm from Indonesia, and I'm third-year DPhil student in General Institute. Mostly research in General Institute focused on developing vaccines against several infectious diseases such as HIV, Ebola, and the diseases that potential to have a pandemic like SARS, MERS, and now COVID-19.
I'm a first-year DPhil student at the NDM, so I'm doing a DPhil in clinical medicine. I did a master's project at Durham University, and that's where I did my undergraduate there too. I saw that there was a PhD position going, funded by Bulgari, and I applied for that.
The students have been really critical in our response. We've needed to pull together everybody that we had on hand who was trained to work in the lab, and that in a large part was our graduate students. So without them, we wouldn't have been able to make progress as quickly as we did.
It was unexpected, absolutely unexpected. There were little rumors about a weird virus expanding and infecting people in China. So after a couple of emails across the department, given the massive interaction that exists between groups, they start asking for people, would you like to join into this effort? And of course, everyone that is doing a research degree here saw the opportunity, and we were like, okay, we need to give it a go.
When I first found out, it was early 2020, and I was completely oblivious that this was going to be frontline. This was a virus that was emerging in Wuhan, and it was causing quite a lot of chaos over there. In February, I was called to a big meeting because I'd been leading in the lab on a trial for MERS, which is a different coronavirus. And they said they were going to give a shot at doing clinical trial for a vaccine for this new coronavirus. As the months went on and the pandemic unrolled, that's when it started to hit me that this would be frontline work. Just had to get on with it.
It's often difficult to get funding for studentships. It's quite an expensive thing to fund, but it's really important to have new students being trained in all aspects of science. And in vaccinology, we cover a very wide range of disciplines, so we want to see people being trained in different disciplines. Philanthropy can really help us with this because it can pay the expenses of a studentship so that we can identify the best students, and we have lots of really talented students wanting to come and work with us in our labs in Oxford. If we can provide the funding to get them through their DPhil studies, we can train the next generation of scientists.
At the time, there was no time to step back and reflect on what we were doing. It was just one foot in front of the other. Ignore the news, ignore your texts, ignore Twitter, keep going, stop thinking about the outside world.
Working in this project is quite challenging. We are racing against time and the virus. We know there's a lot of people dying because of this COVID-19. Another challenge is because we need to work in different situations because of the pandemic, 2-meter social distancing, create less flexibility in the lab.
First couple of months, lockdown was quite severe. for everyone in Oxford. It was a ghost town. As a medic, it was initially frustrating not being in the front lines, but also being in the lab, you can have a certain contribution. Well, I actually got engaged before coming here on August, and I haven't seen my fiancé and my family for more than a year.
When the lockdown restrictions were eased in August, we were still going flat out here. We were working day, night, evenings, till 1, 2 a.m, weekends.
We've still got a lot of work to do. We have to provide the regulatory authorities in multiple countries with all of the details of the vaccine. And that's not just the efficacy of the vaccine and the safety and the immunogenicity, it's also all of the details of the manufacturing process. There are very, very many pages of information that are being transmitted to regulators and that they need to scrutinise. And if they have questions for us, we need to be ready to answer those questions. What we hope we will see is that the vaccine's then licensed for use, and that the vaccine will then start to be used in large numbers of people.
It's definitely advanced my understanding of viruses, of immunology. It's advanced my lab skills. But I would say the biggest advance in my knowledge would be the ability to work incredibly efficiently now. We have volumes of work which I've never seen before.
I'm working with antibody response, and specifically I'm working using ELISA method to measure the antibody response among the volunteers. That method also can be used to evaluate my vaccine in malaria.
I think collaborating with the frontline researchers in different fields is extremely exciting for graduate students. And now after the pandemic occurred and Oxford has produced one vaccine candidate, I think it's a perfect statement of what can happen in academic research and how it can impact the world.
I feel so proud and I feel so grateful that I can be involved in this project because I can contribute I can contribute to the society, that I can fight for the pandemic, and also I feel so granted because I'm working with a lot of people that's super talented and really expert in their field.
The professors, the research assistants, the technicians are the most intelligent, driven, kind people that I have ever worked with. I am so grateful for their input in everything I do, and they are the hardest working people I've ever met.
We made the vaccine using a technology that we've been developing over a period of years here in Oxford, and that's not just thinking about how to vaccinate people and what it will do with their immune systems, it's also thinking about how we're going to manufacture it and how we're going to be able to get it to people, because it's no good having a fantastic vaccine that you can only make in small quantities or is very expensive or is very difficult to transport. So we've been thinking about the different aspects of this vaccine technology well before this year, and we already knew that it was a great technology to use for the kind of thing we need to do this year.
What makes Oxford special is because it connects the best of the academic world with the problems in reality and brings solutions to the problems that we are facing on every day. And the coronavirus pandemic has been the perfect example of this, given the fact that one of the best coronavirus vaccines candidates have been produced here in less than a year. I think there is a special vibe or atmosphere that is shared between all the undergraduate, graduate student members and staff working in the university. And that it's a certain passion and love for knowledge, and how it's developed, and the potential applications that it can bring to the real world.
I think Oxford is very special because we are, as a university, we are independent. Any plan, any decision that have been made based on scientific data in the field. It's very important because we want to build a trust, a society trust in vaccine. So we don't want people hesitate to take this vaccine because we know that vaccine can save so many lives, and we want to prove to the society that this vaccine is safe and effective. We have a lot of support from government, from funding bodies, from philanthropists, and also from the volunteers that are willing to donate their time to work in these trials.
As you know, it's been an extraordinary 10 months since the start of the epidemic in the UK. And Oxford has made a really remarkable contribution to the response, probably more so than any academic institution on the planet. Remember, we've been competing with some of the largest pharmaceutical companies and largest biotech companies on the planet. Of course, the AstraZeneca vaccine is going to be a vaccine which can be deployed all over the world. So it's really the vaccine for the world. One of the great strengths of Oxford is that it is truly an international university. We get a terrific array of students from almost every geography on the planet. And it's those students who come with remarkable abilities, but also huge amounts of energy and enthusiasm to lean into some of the important and exciting research projects that we've got that makes the university so successful in global terms. There are a set of established scholarships in the university, but we're still significantly short of the kind of resources that we need to bring in students from all over the world and give them an opportunity to train here and then to contribute with that massive network they built up in Oxford to the success of the globe going forward. So finding support for these students is the top priority.
As it's sort of coming to a head and things are dying down and 2020 is drawn to a close, I feel like I'm in a better position to sit back and reflect and realise that it was actually a pretty amazing thing to be part of.
As an international student, I miss my family a lot. And when I decide to involve in this project, I'm sure that I can't go home and spend my time during the lockdown with my family, but that's the sacrifice that I made and that decision that I make, and I not feel sorry about that. The fact that I can help so many people by working in this project, it's really make my family proud.
I think in the broad perspective, it's hard to know how things are going to evolve. But personally, I know that I want to dedicate myself to vaccines research, and certainly coronavirus is going to be one of the big research lines.
I'm hoping that now I'm really going to be able to have some time to focus on my PhD stuff. We're looking at really detailed responses to coronaviruses. I'm really focusing on the older age groups, which are obviously the target demographic for this vaccine.
After I finish my PhD, I'm open to any opportunity, but still involved in vaccine related because I believe vaccine can save so many lives. So I want to work in the vaccine field again.
Ability to recruit international students is absolutely at the heart of everything we do in Oxford, and it is probably the most important recruitment task that we've got. Obviously, there are financial challenges to that, particularly if you want to recruit students based on their ability rather than their ability to pay. And we need support for that if we're going to continue the flow of those really outstanding young people who ultimately will go on, and as they have in the COVID epidemic, they're likely to go on and really change the world.